Welcome to the Extraordinary Health Podcast. I'm here with your host, Dr. Paul Beckham. My name is Allie. We also have Liz here.
Hello.
And today we're going to be talking about our ShockWave therapy.
ShockWave.
We're going to talk a little bit about how it works and what it's used for. Did you want to start us off, Dr. Beckham?
Technically, the shockwave that we have is a focused shockwave, which means that it kind of comes down to a point, almost like if you want to think like of a cone, and we have different things that help us make sure that we're getting that focus point to the appropriate depth in the tissue that we might be working on. And some of that tissue could be arthritic joints, like an arthritic knee, arthritic hip, shoulder, hands, feet, any joint that really has, some arthritic changes in it can really benefit, from the focused shockwave treatment. There are all different kinds of this, shockwave therapy there. There's some that are called soft wave. That's an unfocused beam. It comes out, like ours will penetrate to the same depth. It's about 5-6 inches in depth there. But ours, literally, we can kind of pinpoint down to tissue that's affected there. And what's kind of nice about it, it can be diagnostic as well as therapeutic at the same time. So people that have, especially pain that maybe, radiates. I can think of a patient who had some pain that radiated down their leg. I mean, they thought they came in originally, had neuropathy going on. And, basically the testing showed that, nope, they actually just had some issues going on in their right leg. And the way they described it, it seemed like it was more a myofascial trigger point that was causing the issue there. And by using the focused shockwave on it there, we could reproduce that exact same pain that the patient was having. So therefore, it really gives a good diagnosis of, yes, that was a myofascial trigger point. And especially when you get some of the deeper ones that are really like around a hip area, or especially where you have to get through that, gluteal muscles and all that sort of stuff. The shockwave is really good at getting deep into that and getting it kind of knocked out, because I think some of the latest research that I even just got this last week here, they were talking about, it's a fancy word here, they call it senolytics, or basically it's tissues in your body that are starting to get older and die, really. And, what the therapy will do is actually help break that tissue up and get rid of it. And the shockwave actually helps stimulate your body's own stem cells so that you can get new cells growing in there. So basically, we can kind of reverse the effects of arthritis on a joint.
Yeah, it's pretty neat stuff. I want to kind of build on what you were saying with that patient and the diagnostic features as well as the therapeutic features of the instrument. So this particular patient had been trying several things to kind of alleviate his discomfort and kind of get to the bottom of what was going on. And doing that very first shockwave session where I worked with him and running it over that spot and him going, wow, no, that's the pain I feel. That's the pain I feel.
Yeah.
And seeing kind of the relief in his face going, okay, so we're finally getting somewhere. And so that's the really neat thing about the shockwave instrument is, again, it's twofold, two birds, one stone. We get to diagnose things with it and we get to treat those same things, those same issues all in one session. It's pretty neat stuff.
And it does take more than just one session to get it fully kind of knocked out. And depending on the severity, of what a person has going on, we can give you a pretty good idea of what you're really going to need to get it kind of knocked out. And then a few people are going to need, especially if it's more on the moderate to severe end of the spectrum, probably just some ongoing touch-ups periodically with it, just to help keep the problem from kind of coming back. But also those people are going to probably, we need to look at them more from a chiropractic sense, biomechanical sense, just to make sure they're not loading those tissues again. And that could be using things like we talked about in the last podcast, orthotics, heel lifts. Could be that we just need to do some extremity adjusting and, take them through an extremity screening there to find out exactly where they have problems at, so we can make sure we're getting everything taken care of. Not that the shockwave makes everything disappear, but it's very awesome when it comes down to myofascial trigger points and arthritic joints. I have personally not seen anything work this fast on a patient in 30 years. I mean, I've not seen anything at all. So,
And don't the effects, like, they sometimes you don't feel them immediately, but they do continue working for, what is it, 12 weeks
yeah,
after?
they'll say that, after we're done doing the treatments, a lot of people, they're probably going to get anywhere from 4 to maybe a dozen treatments is probably the most typical pattern. So that might happen over, 1 month to maybe 3 months of treatment. You're actually going to get, yes, another 12 weeks of basically your body, your body stem cells
Healing.
being stimulated and helping to change the area over that next 3 months. So it's even good just to kind of follow back up again at that 3-month interval and just kind of see where you're at, because if we can go in there and run the focus shockwave again over that tissue and you're not getting those sensations going, you don't feel any discomfort, we can't locate anything, you're probably good to go. We probably don't even need to worry about it unless you have something start to show back up again. Obviously get in as soon as possible, because then it'll just take a few treatments probably to get it kind of back into shape again. So
Yeah. So, 4 to 12, that's pretty typical for what we see here in the clinic. You might be wanting to call it our magic wand, but it certainly isn't, because it doesn't fix things overnight. But like Dr. Beckham said, it does work relatively quickly. And depending on what we're working on, like Liz said, you won't necessarily feel it immediately. Some things you will. I know that personally, I've used it on my lower legs and my feet for some chronic plantar fasciitis issues I've had. And immediately when I'm done with a session, even just rendering it on myself for a few minutes, I have more freedom of movement in those muscle structures. I feel like my ankles are flexing a little bit better, and so on and so forth. You can feel the blood flow, and it's really neat stuff. Like I said, so you sometimes feel the relief right away. Sometimes you don't. It takes a few days, but it also lasts for an extended period of time. So
Yeah, everyone's kind of different. Depends on the case, depends on the person.
yeah.
depends on how much scar tissue is there. I mean, I think probably
Yes.
one big thing that I've also seen it on, other than using it on arthritic joints or myofascial trigger points, are some patients that have had scar tissue from injuries or surgeries, and just how much it helps make the tissue much more pliable. I know in the past I've done things like A-stim, where we use like a metal instrument to kind of help work on that tissue and break it up. And I'd always tell people we can probably get 80 to 90% of that to go away, and that would probably be the normal scenario in the past there. But now with the focus shock wave, and also with our what's called RPW, or radial pressure wave, I can say we can probably get 95 to 99% of that scar tissue out of there. It's just helps that much more to reduce that so that people get better function out of it. And like I had a patient we used it on, and I've done all of the other stuff before with her, and she had some of it kind of creep back a little bit. I would say she probably had still around that 80% range of the scar tissue was gone, but literally using the RPW, the radial pressure wave, which is a form of shock wave, and using the focus shock wave, it's like, I would say it's closer to 98, 99% gone. She's had very little issues with it afterwards. So, and everything's functioning really, really well for her too. So, getting that scar tissue kind of worked on, whether it has been from an injury, where you've had some tissue damage or something like that, or even if you had a surgery where you've had some surgical scars and there's actually some, fibrous tissue that's still kind of hanging on. That's where a lot of people start to have problems, is that when your body lays down scar tissue, it's kind of like a spider's web. It can be super thick in certain areas there, but it can actually reach out, and literally can go through your whole entire body, where you can have some restrictions from the scar tissue getting laid down. Typically it stays in a very local area, but some people, their bodies just get affected differently there. But that focus shock wave is just awesome at just even kind of breaking up some of that, like that senolytic type of a process there where it's going to break down some of that tissue that has gotten older. It's not functioning like it should. It helps to break that down, stimulate those stem cells again so that you get your body's own stem cells. So when you're stimulating the stem cells in that area, if it's a ligament, it's going to help stimulate the stem cells of your ligament. So instead of having to go out and find or get differentiated stem cells, this will be a whole nother area of things we can kind of go through here. You're only going to get that in a university setting where they have differentiated stem cells where they can inject it into like a joint because they actually have tissues that are going to help regrow that type of tissue. Typically, if you get stem cell therapy in other places, they might spin down your fat. They'll take out some fat out of your body, get stem cells out of there. Some places can use your blood and get the stem cells out of there. Multiple different areas where they can get it from, but those are undifferentiated stem cells, and it might be 99%, but you might only get 1% of the stem cells that are going to work in that area there. So using some of these therapies here that are being found to help stimulate your body's own stem cells in the areas where they're already at, like I say, I have not seen people respond quicker with any other therapy in the past. Yeah. Other than the focus ShockWave. It's just crazy how much better people can get with it. So
I always do warn people that it's not the most comfortable therapy. It's not super relaxing because we are trying to focus on those tight and quote bad areas,
the painful, inflamed,
yes,
and restricted areas. Yeah.
So it's not the most comfortable, but that's the only way that we can really know that we're treating that area is because we know that if there's pain there, that's where we should be working.
Yeah. And typically run the therapy, like if you're looking at a pain scale from 0 to 10, we'll always turn the machine down. So you may be feeling a pain level about a 4 or 5, but we do need to make sure that we're running that therapy over the areas that are the worst because that's where you're going to get the best results from things. And probably the quickest results if we can really focus in on those areas there and get them resolved for you. So,
yeah, generally, I mean, most patients that I have treated with the ShockWave therapy will say something to the effect of, no pain, no gain. And generally speaking, I'm not a huge fan of that phrase because we can usually treat things relatively painlessly, right? Yeah. But with this particular instrument, we are looking for those areas that are more painful to kind of like Dr. Beckham said, focus in on those things that are the issue, the root cause of the issues. So it isn't, like Liz said, the most comfortable thing in the world, and that's to put it lightly. But it only lasts, 5 to 10 minutes per session. And like Dr. Beckham said, we'll always fine tune it so that it is within your comfort area and it is, easily, tolerable for each individual patient.
Unbearable.
No, not by any means. No.
I always tell patients, like, you are in charge.
Yep.
You just have to communicate with me and let me know how it's feeling, what's going on, but you're in charge for the most part.
I will say it beats a poke in the eye. So.
Yes, it does.
And it almost feels like I've had some patients kind of describe it as like a hurt in a good way kind of way. I like to call that therapeutic pain. You can tell that it's a positive thing that's happening. Your brain can kind of differentiate between a bad pain and a good pain. And that's the sweet spot that we're looking for, is that therapeutic pain range.
And to me, I guess, even to kind of explain what the therapy is here too, so you kind of understand it a little bit better here. It's an electrohydraulic therapy. I'm going to just try and use as simple a terms as possible. It's like a spark plug that's in some water, and we use a conductive medium, like an ultrasound gel is basically what gets used to put on your skin so that we can get this therapy into your tissues there. If your tissues are normal, you're not going to feel anything. But if you do have areas that are bad, where you have pain, inflammation, there's like myofascial trigger points built up in there, really inflamed joints, that's where you're going to feel it, and those are the areas, it's typically going to reproduce the pain that you've already been feeling, and those are the areas we definitely need to get treated then, because once we get through with the treatment, you're going to be like, wow, yes, especially after one treatment, most people, the average person is like, they're going to definitely feel less pain. Some people don't feel any pain when they get done. I know I've had it done on myself, and I would say, pain levels went from, I would say 89 to 90% better after I even had that first treatment. Did it come back? Yes. Did I have to do multiple treatments on it? Yes. I think I had, 11 treatments like on a lateral epicondylitis, and I have not had any issues with it ever since. So that's where I think a lot of people would end up having problems before. An example would be this therapy is being used in a lot of professional sports teams' training rooms, like Major League Baseball. A lot of the teams have these therapies in there, and just like I say, it's used as a diagnostic thing as well as a therapeutic thing. Especially with baseball, they run through their players' arms and up to their shoulders to make sure, and especially once you kind of know where the problems are at to begin with there, you can go back to those and see if they've gotten them resolved. If they don't have any pain there, guess what? That tissue is healthy. They don't have any issues there. But if you're repetitively, obviously, throwing a ball, you may be getting injured, hitting a ball, and you get those little zingers up into your hands every once in a while, you might be damaging some tissues, and trying to stay on top of it and using this therapy even a proactive way can be very, very beneficial to, athletes here, because then they're not going to have, that discomfort when they're playing, and they're not going to keep accumulating those injuries on top of each other. And so you're going to have a lot longer playing life because you've proactively been dealing with those micro traumas that happen on a regular basis.
Yeah. So, kind of building on that too, how do you kind of know that it's working or that you're progressing? That's my favorite part about the treatments. Like, let's say somebody signed up for an 8 treatment package, and we're on their 6th treatment. They got a couple left, and they say, "Oh, it's usually right here in this spot." And you run over that spot, and you go, "Okay, do you feel anything here?" They go, "No, it's." Are you sure you're there? Yep. This is where we were a couple days ago. And they're not feeling it that intensely. And then that's how you know it's been working. And that is a wonderful feeling.
Mm-hmm.
Or you even have to turn the intensity up.
Yeah.
Because, they're not feeling it there. I mean, it's only going to go up so high, too. So we know once we've gotten there and we have this turned up kind of as high as it'll go, we've pretty much got that condition resolved for you there. And you should be sitting pretty good with it there. So...
yeah, so we've covered what it's used for, what exactly is it, how do you know when you're getting better? Why don't you add a little bit to that? How does a person know that they're progressing or getting better with the ShockWave treatment?
Well, that too, and something else I'll get into as well with it here is how we're using it with some of the other things that we do in the office here too. So how do people know that they're getting better with it? I mean, obviously you're going to start to see improved function, because a lot of people come in, they want that pain relief there. I mean, it's definitely going to give you the pain relief, but until we get the proper function back to any of those tissues, if we get the pain relief back, we might be at about 40, maybe 50% of function. Well, what's going to happen if you just stop treatment?
Vicious cycle.
Yeah. I was going to say,
All of a sudden,
back to square run.
Yeah.
I said square run. Wow. 1.
It's okay.
Oops.
We might have to use that on your jaw later.
I was going to say, yeah, let's use some coffee and some therapies now.
But yeah, I mean, if we don't get it back to full function here, that's where people are going to have, things starting to recur on them. It's not a matter of if it's going to happen, it's a matter of when it's going to kind of recur. And depending on what they're doing is going to depend on how fast that probably comes back again. So we always want to try and get back to as close to that full function as possible. So as we were able to go through the treatment there, and that's where, we can probably give you a pretty good idea of what we think you're going to need for treatment and all that sort of stuff with it to get you back to that full function. And, we're doing probably other procedures as well. If it's an elbow, you have lateral epicondylitis, we're going to make sure we're probably, getting that elbow adjusted. Focus Shockwave is really good at all the soft tissue type things, so all the muscles, tendons, ligaments, joint capsule, joint synovium type tissues there, and the nerves even that go to that area, the pain fibers. So once we get that stuff resolved there, you should be sitting pretty good. But one thing that just kind of comes to mind here, other things that we use it with in the office here that are it's just hugely beneficial are things where people have a disc condition going on, and we're literally using the focus shockwave to help stimulate those stem cells, because when people have a degenerative disc, it takes time for that to heal up. And with how far this penetrates, we can get down, pretty close, if not, running it almost right through that disc and in the vast majority of people, to help stimulate the stem cells so that your disc can even heal up. And combining that with, spinal decompression therapy and even some laser therapy that helps to improve blood flow and even regrow the nerves and tissues around the area there as well. So,
yeah, I can't stress enough how a joint dysfunction in your spine, so like a disc dysfunction in your spine, I can't stress enough how slowly those will heal if you do not address them, period. And if you're only addressing them, by getting adjusted, sure, things are going to improve slowly over time. But if you can add the extra things like the decompression and the shock wave and laser, in conjunction with all of those things, you're going to improve a lot more quickly. There's not a lot of blood flow going into those discs, into those intervertebral spaces. There's not a lot of blood flow back there. There's other fluids, but not a lot of blood flow. And that's where, we kind of rely on cellular metabolism and things healing because of that increased blood flow. So with the shock wave, you're going to improve the quality of your treatment and speed up that process so much more.
And it builds over time with it too. So it's kind of like you're getting a little bit more and a little bit more of those tissues kind of regenerating themselves there. And, as you would go through a treatment, I could probably adjust somebody's spine until the cows come home if they have a disc problem. We're never going to get it better unless we're using decompression therapy. And in some offices, that's what they use. But by literally adding in the focus shockwave treatment and the laser therapy there too, we're getting better blood flow to those tissues. We're getting down deep into those tissues. There's no other way that's going to happen unless you literally have a spinal surgery, but then they're taking pieces out, you're getting things fused, and that
it's a domino effect.
It's a huge domino effect with surgeries, because once you have one, then you're pretty much setting yourself up. You're going to have another one, and then another one, and then another one. And, we want to minimize or completely eliminate that from even having to happen. So,
I actually have a friend that had a consult for spinal surgery, and the nurse that had checked her in to go see the neurologist had told her, "Oh yeah, I've had 6 of those." Well, that's not what you want to hear.
No.
Like, there's got to be another way.
there's definitely other ways, and I don't know of anybody lately here that I've even had to send them for surgery. Just with all the therapies that we have here right now. And I just, like, before we probably wrap this up here too, one other thing that we're even using the focus shockwave with is the patients that have neuropathy going on, especially the really severe ones, where they've literally, had their nerves and their blood vessels, deteriorate in their hands and their feet. So by literally using the shockwave, we're stimulating again the stem cells in those areas there to help those heal up. And again, once we can kind of find the areas that are the worst, using that therapy there, because we can then target it, you should be having those stem cells get stimulated and helping you regrow the nerves and blood vessels. That in conjunction with the laser therapy there, just helps stimulate just about all the pathways possible for your body's own stem cells to help regenerate tissue for you.
So that's one of the things that I absolutely love about the shockwave therapy too, when you're talking about adding it to other therapies and treatment plans, is how easy it is to incorporate that therapy with other therapies in the treatment plan, because they don't conflict with each other. As far as contraindications, they're very minimal. Actually, why don't you touch on that real quick before we wrap it up here?
I mean, with any kind of electric therapy there, we just have to watch out for things like pacemakers, defibrillators implanted, like TENS units, or have some people with some implanted devices for like sleep apnea and stuff like that. We just don't want to be running any kind of electric stim on your body. We don't want to be shorting out the things you have in your body there. So those would be counterindicated. Pregnancy, those are the biggest things here that we want to watch out for.
Still a pretty short list.
Yeah,
There are a lot of other therapies that have a lot longer of contraindications lists.
And probably the big thing with all the therapies that we use in the office here, there really are no known side effects to them. I mean, like medications, I mean, you've seen the commercials on TV. If you have to speed things up that fast so that you can get in all the contraindications and side effects that you have from the medications, we don't have that with the therapies here, other than that short list that we just listed off of people that we just don't run on out of greater precaution so that we're not causing any problems here. There are no known side effects to ShockWave, to our high intensity class 4 laser, PEMF therapy. They're all helping your body function normally. They're just putting more energy in your body is what basically they're all doing so that your body can heal itself. So
pretty neat stuff.
Yeah, I'd say.
If you have any questions about the shockwave therapy, and if you're wondering if it's right for you, you can always contact us, ask the questions. We'll get you some answers, and you can always come in for a free consultation, talk to Dr. Beckham about your options and whether it's right for you. Thanks for listening.
Bye.
See you next week.